Good morning, Alex and friends. I'm Grace. Today is Sunday, June 15th, 2025, and you're listening to Alex's News. The weather in Riverside will be a hot 96.3 degrees Fahrenheit today, with the low dipping to 66.1 degrees. It's definitely a day to stay hydrated and seek out shade, especially if you're planning any outdoor activities. Later in the program, we'll be breaking down a significant topic: what the recently enacted immigration rules signify for California's complex healthcare landscape. We'll explore how these new regulations are impacting access to medical services, the healthcare workforce, and the overall system across the state. All this vital information and more is coming up next here on Alex's News. Stick around. Federal immigration policies are casting a long shadow over California healthcare access. Fear grips immigrant communities. Our reporter, Ethan, is here. Ethan, let's start with a tense encounter at a Los Angeles clinic. What happened?
Grace, it was quite a standoff. Our reporting indicates St. John's Community Health, serving a significant undocumented population, had a close call with individuals believed to be immigration agents near one of their clinics.
How did clinic staff react?
Staff, including Manager Contreras, truly held their ground. Our reporting indicates Contreras told the guard, "Don't worry, they can't come in without a warrant." The agents didn't exit vehicles, and no arrests were made. A clinic official described it as held our ground.
This isn't isolated, right? It links to a federal policy change.
Correct. This illustrates consequences of a major policy shift by the Trump administration in January. They rescinded a directive limiting immigration enforcement at sensitive locations.
What are sensitive locations?
Historically, these included schools, places of worship, and healthcare facilities. Legal analyses confirm this was an internal DHS guideline to avoid enforcement, ensuring safe access. The rescission removed a self-imposed restriction.
Impact on California healthcare access?
A chilling effect. Palo Alto Online, Cal Matters, and the Merced Focus report fear of raids causes many to cancel medical appointments.
Specific numbers?
St. John's reports many patients, including those with chronic conditions, canceled. Our reporting indicates that as of today, June 15, 2025, their clinics experienced a 1/3 medical cancellation rate and 1/2 for dental appointments.
How are clinics responding?
Proactively. St. John's conducts Know Your Rights sessions and launched a Healthcare Without Fear program offering home visits.
Broader enforcement and state response?
Escalating enforcement. Palo Alto Online, Cal Matters, and the Merced Focus report Los Angeles protests. Rallies in Palo Alto, Merced, and Modesto drew large numbers. Earlier ICE raids in San Diego foreshadow current roundups. Raids on California farm workers also impact our food supply.
California's political leaders
Expressed outrage. Governor Gavin Newsom, per Palo Alto Online and Cal Matters, condemned President Trump for sharing immigrant health data, calling it outrageous. A federal judge is also hearing Newsom's case regarding Trump's authority to deploy troops in Los Angeles. Federal agents even subdued Senator Alex Padilla, removing him from a Homeland Security press event, drawing widespread outrage from California Democrats.
Other concerning reports?
Yes. The same sources report California police may be illegally sharing license plate data with ICE. Gregory Bovino, known for misleading the public, now leads Border Patrol in Los Angeles. California Democrats also tightened rules for an immigrant defense fund.
Ethan, sensitive locations policy isn't formal law. Legal context?
Legal analyses confirm it was an internal guideline. Its rescission removed a self-imposed restriction. However, ICE's ability to act in healthcare is still governed by the Fourth Amendment. They can enter public areas, but generally not private treatment areas, without a judicial warrant, consent, or exigent circumstances. An administrative warrant isn't sufficient.
Hospitals aren't powerless?
Not at all. Healthcare facilities are bound by HIPAA, restricting protected health information disclosure. EMTALA requires Medicare participating hospitals to provide emergency care regardless of immigration status. California also has laws like the California Values Act, SB 54, limiting state and local law enforcement assistance.
This fear is intensified, but has ICE always been strict about this policy?
Good question. According to ICE adherents pre-2025 reporting, ICE's adherence wasn't absolute. A Physicians for Human Rights report showed between 1995 and 2017, at least 80 hospitals across 18 states were utilized by ICE.
So, not new, just a shot in the arm?
Precisely. Even during the Obama administration, a 2009 study found immigrants missing appointments out of fear. During the first Trump administration, guidance was often largely ignored, leading to documented fear and decreased healthcare utilization. Reports showed a 10 to 20% drop in hospital visits and 30 to 50% no-show rates. It's an exacerbation of a long-standing issue.
What are healthcare providers doing to protect patients now?
Implementing best practices, according to the Healthcare Provider's Guide, and immigrant access to healthcare reporting. These include clear staff protocols, know your rights training, empowering patients with multilingual materials, limiting immigration status collection unless medically necessary, securing patient records, consulting legal counsel, and clearly delineating public and private areas.
Ethan, thank you for this vital information. Your reporting helps us get to the heart of it.
My pleasure, Grace.
Here are some other headlines. Tragedy out of India, where the death toll from a devastating Air India crash has now reached 270. The Boeing 787 Dreamliner, bound for London, went down moments after takeoff from Ahmedabad, striking a medical college hostel. In a tragic turn, 29 of the victims were on the ground, many of them medical students. The crash claimed the lives of 241 people aboard the flight, including former Gujarat Chief Minister Vijay Rupani, with passengers from India, Britain, Portugal, and Canada. In what can only be called a miracle, there was a single survivor from the aircraft who reportedly escaped through an emergency exit. Investigators have recovered the black box and are hoping it can help them get their investigation off the ground. The incident marks the first fatal crash for a Boeing 787 in its 16 years of operation. Stateside, a massive manhunt is underway in Minnesota for a suspect accused of what the governor is calling a politically motivated assassination. Authorities are searching for 57-year-old Vance Luther Bolter, who is considered armed and dangerous. He's accused of fatally shooting State Representative Melissa Hortman and her husband, and seriously wounding State Senator John Hoffman and his wife. Officials say Bolter was impersonating a police officer to gain access to their homes, playing a truly deadly role. A search of his vehicle uncovered no King's flyers and a list of more than 50 other potential targets. The FBI is now offering a $50,000 reward for information leading to his capture. Overseas, horror in north-central Nigeria, where gunmen have killed at least 100 people in the village of Yelwata. According to Amnesty International, entire families were locked in their homes and burned alive in the overnight massacre. The attack is the latest in an ongoing and violent conflict between nomadic herders and settled farmers over land and resources in the nation's volatile Middle Belt region. Amnesty is condemning Nigerian authorities for what it calls a failure to stem the violence. In Washington, the Supreme Court has a very full docket as it heads into the final weeks of its term. The justices are set to rule on 21 cases, weighing some of the nation's most contentious issues. Rulings are expected on a Tennessee law banning gender-affirming care for minors, the legality of a Trump-era policy to limit birthright citizenship, and a religious freedom challenge from parents who object to LGBTQ+-themed storybooks in schools. Also on the docket are cases concerning age verification for adult websites and a racial gerrymandering dispute out of Louisiana. And finally, French President Emmanuel Macron is giving a cold shoulder to Donald Trump's Arctic ambitions. Macron is in Greenland today in a show of European unity after the former U.S. president reiterated his desire to acquire the territory, not ruling out the use of force. Both Greenlandic and Danish officials have firmly stated the island is not for sale. Macron's visit is being seen as a clear signal to Washington, a diplomatic move designed to ice any American plans for a transaction. That's all we have for now. Today's episode was made by Alexander King with Claude Sonnet 4.0, Gemini Pro 2.5, Gemini Flash 2.5, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.